Joyce Gibb, and today I wanted to talk to you about a recent study that came out in Lancet, and it was about diabetes and endocrinology. It was in that section of Lancet, and it talked about vitamin D not being beneficial for your bones. So first thing I want to do is review the study and then just tell you my take on whether this is reputable or not. So what are some things that we could look at as to why maybe this isn't the best study always. So CNN, they had a big headline that came out and says, vitamin D does not improve your bone health. The New York Times showed that vitamin D supplementation doesn't lead to stronger bones. So the study that was done, there was one person in, two people in New Zealand and one person in Scotland that headed up this study. And it was a meta-analysis, and it was a randomized controlled trial study, which when you look at those are supposed to be the highest level of evidence that points to the study. So, it looks like it was a great study that they tried to do. There were adults ages 18 to 65 years of age, and 2/3 of the people actually were 65 years of age and older. So of that randomized controlled study, which they brought in 81 studies total to look at all the evidence, and of those 42 of the studies reported hip fractures, the 37 reported falls, and the remaining 41 reported bone density scores. So when you look at the meta-analysis, that's really a pretty broad range to say, how does vitamin D affect those things? So one of the things that they did find that the outcomes were total hip and hip fractures, the bone mineral densities, and falls. And then of all those total studies they looked at, I just broke those down. So basically, the study found that vitamin D had no effect on total fractures, hip fractures, or falls. And then there were subgroups within the study. So the first one, there's always a control group whenever I name these three. So there's always a control group, which means they, don't do anything and just basic, just continue as you are. But vitamin D, there's a vitamin D supplement group and a control group. The other subgroup was high and low vitamin D versus control group. And the last one, they had a specific population, which was diabetes, was it heart disease, etc. in those populations. So one of the things, there was the lead author is Dr. Mark Boland, and he had previously published other studies about calcium and how calcium in your diet, those foods in your diet, or calcium supplementation does not lead to improved bones. And so that was back in 2015. He had a study that talked about that. So he's kind of known, just kind of trying to prove what supplementation helps or doesn't help now. So what I look at the study, I'd say, okay, you look at the study, were the people in the study, first of all, New Zealand's pretty sunny. United Kingdom's not so sunny. So were the people in these studies, did they have a lot of vitamin D exposure from the sun or not? So you have to look at that. Maybe they had an okay vitamin D level in the first place. Then you have to look at, was their baseline vitamin D okay? Were they taking the supplements for too short of a period of time? What in the high vitamin D group, what was that amount of vitamin D? What was the low amount of vitamin D in the control, in those groups? So, and I have just seen clinically, if you do 2,000 IUs of vitamin D, I bet for 20% of the population that's pretty adequate. We live in the Pittsburgh area, and most people need a lot more than that, at least 5,000 to 15,000 IUs of vitamin D. So what did they check? What were their levels in the serum that they checked to say, what was normal? When you look at a typical range of vitamin D, it's 30 to 100 on the lab ranges. But we know for research and to benefit your body that 50 to 80 truly is the range that it should be. So what ranges were they using? What other risk factors were there that proved that vitamin D was not beneficial? Did they have any activity? Did they have a poor diet? Did they have a lot of stress? Was their digestion poor? So when you look at studies, the take home from this is when you look at a study, you have to look into it a little more in depth than what they actually do in the meta-analysis, which is a really good really a good research protocol. So, but there's a little more to it, and that's my take on it. If you'd like to talk about your health and your journey to better health, give me a call. Thanks a lot. Thanks for watching. If this information was helpful, hit that thumbs up button down below. If you want more videos like this, hit the subscribe button down below, then ring the bell next to it. Also, if you know other people that you would want to share this link with, please do so, because I would love to help them on their journey to good health.